understand people while they have a mask on. Those interferences with education is not nearly what one sees if you have to quarantine a school or shut a school district down because of rapid spread of the virus. So there is no question from a scientific basis or from a public basis that masking in schools is a prudent step to take at this particular point in time. We'll move on next to talk about boosters, when they'll be available and when they're advisable for all. Boosters are currently recommended and are being given to individuals who have compromised immune systems, whether that's from an active cancer, a solid organ transplant, or the receipt of medications that are intended to suppress the immune system to help patients with diseases like rheumatoid arthritis. So those individuals are already eligible for a booster. I think other places that have studied boosters, including relatively detailed information from Israel, shows that the third shot does indeed bolster immune defenses and protects individuals who are at risk. For others who don't have those conditions, the current thinking is that boosters will be recommended for those individuals who are 8 months or after their initial inoculation, beginning in mid to late September. So we're still waiting for information on that. I personally think that that is a prudent step to take. There is, again, preliminary data from Israel and from other locations that using a third dose does continue to improve immunity and further benefit recipients in terms of their risk of acquiring serious disease or winding up hospitalized. The next question is about what therapies are effective in controlling the virus. There are very few proven therapies for the virus. One thing that has been shown in multiple studies to help are certain monoclonal antibodies. These are antibodies that are raised through laboratory strategies that combat the virus. And currently, there are a number of individuals in the St. Louis metropolitan area who are at risk for COVID, have not been vaccinated, and can receive monoclonal antibody infusions to mitigate the risk of disease. Further, we have just recently had approval for individuals who are at high risk because of underlying conditions or advanced age, who are exposed to someone with active COVID infection, can also receive monoclonal antibody as a preventive measure. We are currently doing our best to upscale demand or infusion capabilities so that we can meet demand, and there will be more in coming days about those measures. Other questions that we received just before this broadcast. First question, I think I've addressed whether most or all of hospitalized children have underlying conditions. The correct answer to that is most have underlying conditions, not all, and certainly not all kids who have severe infections or have underlying conditions. So it can be a pretty devastating illness for young children. Are hospitals turning away patients due to capacity? That's the second question. We have had days in which we have had to curtail transfers. Normally, St. Louis serves as an important referral center for cases from all around the region that are too complex for local medical resources or need some special therapy that we can offer here. There have been occasions over the last few weeks where we've had to decline transfers from outlying hospitals because we simply don't have capacity. We have also had to limit a few elective procedures, or at least postpone them if they were going to use a hospital bed. Fortunately, if we continue to flatten, we should avoid the need for a lot of postponements, but that's really to some extent in the hands of the citizens to see if we can stick with our precautionary measures that limit spread. Are there alternate options outside a patient's primary location for care? Question number 3. There no doubt are ways people could get care needs met elsewhere. I don't believe that's necessary. I believe that your doctor, your provider, whether a generalist or a specialist, understands what resources are available and can work to schedule any needed care in an appropriate time frame. And of course, anyone with a medical emergency should come promptly to the emergency room the way they normally would to be taken care of. So my sense is that no one really needs to move outside the region for alternate care. There are a couple of exceptions. We've had to transfer a patient out of St. Louis to get ECMO therapy. We talked about that last time. That is one example of someone who had to go elsewhere, but that is not a patient-level decision to make on the way to hospital. That is a professional decision that would be made by the caregivers in the receiving institution. The next question says, what if someone is expecting to need surgical or medical care in the future? How should they plan? And I've already answered that in part. I think your providers have enough information about the current situation to know how to plan for that. We are currently not seeing a huge number of procedures being postponed, only a handful. And if the numbers stay where they are, we should be able to manage through without dramatic postponements. If the rates go up, if school brings in a new round of transmission events, or if people are not cautious over the Labor Day holidays and we see a new surge, that may test that statement. But again, I think right now we are getting by. That would be the best way to say it. And the final question is, are there overflow spaces outside the hospital, and will there be a need for that? We really didn't have to do that the first time around. We set up one alternate care venue using the National Guard resources and really didn't need to use that. We do have additional physical capacity in our hospitals. We just don't have staff for it. But there are ways that if we were really in a crisis, we could potentially expand to use that physical capacity. I do not anticipate a scenario that would require us to take care of patients outside the hospital. So that brings us to the end of our questions. I will just reiterate my plea that all eligible individuals need to get vaccinated. That is what is going to get us past these recurrent surges and get us back to normal in our population. Waiting for immunity from acquired infections is not going to stop these surges in the near term. While we are waiting for people to be vaccinated, we need to continue to use masks in risky situations. So if you leave your home, anytime you're going to be indoors in close proximity to others whose vaccine status is unknown, you should wear a mask. My personal recommendation is anytime you go into a store with individuals who are not in your personal pod, you should be wearing a mask. If we can continue to do that, I think we'll continue to see flattening of the curve, and we'll get through this as a region with less pain and suffering than we've seen in some other places. With that, I'll conclude my remarks for today. Thank you for watching.